or bring up a question as I'm talking about this, try and share with you maybe some of the loopholes I experienced this year with individuals. So again, real quick, looking at why do we benefit from a drug-free workplace policy? What's your responsibilities for it? What does intervention and referring them to the EAP looks like? This time when I'm doing the training, I am going to emphasize more thinking really about what does protecting the confidentiality of the individual look like. Because I do know that in some companies has become an issue, and it is I don't know, it's making that noise, but so this year we'll focus a lot about that. And so definitely it would be interesting to know then what is everybody's familiarity with the drug-free workplace policy, because that is what helps you be more effective in implementing it. But because everything changes yearly and some of that it is an ongoing thing. So part of it, the reason that everyone benefits, and that, of course I've been doing this since companies first started having to have the drug-free workplace, and everybody was so and felt that it was a violation of their rights, and lots of anger. I don't even know how many years now. Long time. But recognizing that the besides it becoming a fiscal issue for workers' comp and making companies more viable, it is an effort to create safety in the workplace for everyone. It really is, and part of that is that it does send that message out to employees from that, substance abuse or impairment in the workplace is prohibited. And it also is meant to encourage individuals to voluntarily seek help. Now, again, we recognize that for individuals that have addiction, what's one of the primary symptoms or problems with addiction?
Denial.
Denial, thank you. So, if you think about that piece, then those individuals, aren't going to voluntarily seek out services when you really understand denial. But a lot of this, especially having the EAP in that voluntary part, is for individuals that do recognize that they might be developing an abusive relationship with alcohol or substances, or might be struggling with that, and would choose in recognizing that they have this resource available and be able to seek it out and use it to their benefit. And so, again, then the policy is meant to protect everyone in the workplace. And I always emphasize, sometimes, even though we recognize it's meant to protect everyone, employers and supervisors at times focus only on protecting that one person that's abusing the substance. And that part feels crazy at times, why that person's rights seem to take precedence over everyone else's. But I can tell you now, I've been doing this 30 years, I see that dynamic happen over and over again, and running to really recognize that it's meant to protect everyone, and it is oftentimes the only way that person, that when we think of the addicted person, it's the only way at times that they actually are able to get help. And so I think part of that is that we keep having these trainings every year because we all lapse into denial also. We all want to think that it's really not that big of a deal, or that, people will get help on their own, or we often minimize too what we're seeing. And so some of that is just human nature. So having these trainings yearly is also to help all of you not minimize, not go back into denial about what you're seeing as well. So that, I apologize. If you ever one year want us, or maybe next year, we could just do a whole policy review as part of the training. If you need to do that
might be a really good idea.
Yeah.
And pull it back out, dust it off.
Right. Because some of my questions all are for that. So again, your role then, if you think about it, is that you play that key role in creating that safe, secure environment Also, in making sure that you stay on top of what you're seeing with who you're supervising as far as what their performance looks like, that you do treat everyone fairly. And you know, it's funny, that's like the big thing I hear the most often from employees is that they feel this, you know, across the board, across the 23 companies that I still cover, they feel that disparity at times in how the, you know, supervisors treat one person over another. And then, of course, we want to make sure that you're acting in a respectful manner and not in a demeaning way as far as people. But, you know, when we look at this, if you as a supervisor really do just focus on performance and make referrals appropriately based on that, it can save you a lot of headache later on down the road than when things start to snowball and get ugly. So it's kind of like there's this fine line of when you start to first witness the behavior and before it starts to get real, you know, really difficult. So again, recognizing, I mean, I always say this every year, so even though we go through this whole training and teach you all this, it's not your responsibility to diagnose the person as having drug or alcohol problems. It's only meant to be that you are recognizing certain symptoms associated with that. You don't have to have all the answers. One of the nice things, again, with the merger is we do have a 24-hour consult line as well. You know, so it's not just a 24-hour crisis line, but even if you needed to call in and consult with someone about something that, ironically, sorry about that, you guys, no pun intended, that you don't need to be a police officer, that you do have that available to you also, whereas, you know, previously, while we had the 24-hour to reach me at times, you know, you still had to depend on my ability to be there. So from a legal thing, though, and this is like the part that I emphasize, is that you know, that employees' confidentiality. And how many of you saw the Beacon Journal did the article of the woman that was being drug tested? And you know how you have to have somebody come into the urinal with you for the drug testing, and she's suing because she felt that it was an invasion of privacy and a breach of that. And so she's opened up a whole doorway about what does that look like, having somebody come in and watch you take your urine test. So it's interesting if we follow to see what happens with that.
Why is it, where I came from, Stark County, that was a standard practice. It is not up here at UH.
Really?
I don't get it. Can anyone tell me if you've ever had a random someone that's come in with you?
I was drug tested in Stark County for years, and I never had anyone come in at Mercy.
Well, we used Staff Care. We used the health center over there on Whipple, and
The other direction now in that prescribing. So hopefully we'll land somewhere. I mean, obviously we need to do something now in addressing it, but yeah, it's
they went from full go to no go.
Yeah.
So when people go in there and they're truly in pain, they give them Tylenol. I mean, it's a scary situation.
It's funny though. I'm trying to think. Someone just had, and he told me that he was doing fine. Like he had a knee replacement surgery or something, and he's not, you know, no pain meds. And he said that he's managing the pain fine. So it is interesting hearing something like that as well. But so, as a supervisor, remember, you want to be documenting the performance problem. So first of all, you want to make sure you're seeing those clues so you recognize when to start documenting. You want to use constructive confrontation. Always make sure you have a third party there with you. And then, of course, she would be your go-to person when it comes to consulting about an individual, what you're seeing. You can always call me. Always making sure you follow up then with that person. And so we're talking about the beginning stages before you're going to make a mandatory referral to the EAP. But remembering, in all of these things from an EAP standpoint, when the mandatory referral comes because of something that you're witnessing, we benefit from knowing all of this other that you've been seeing. And so another new thing with the merger is that, so again, like in the old days, I might have had you call me and share with me everything that you were seeing. And sometimes that wasn't always, we would find it wasn't always communicated with the employee. So in that referral, the employee, oftentimes we would have the individual say they didn't even know why they were being referred, or, they didn't know what, the employer's just saying they've noticed this about them. I mean, this is in the absence of them testing positive. So it made our jobs difficult. So now with the new company, anybody that you send for a mandatory referral, they have to read all the documentation that you are sending us and sign off that they know what we are reading or seeing about that person. And then we use that to help us also in counseling them and moving forward. The piece you want to be careful about is if you use coworkers' statements in support of why you're making this referral, then you need to think about how you're going to protect those coworkers' statements. Because remember, when we take statements, we have them sign their name and all of that. So it's something to think about differently if you're using that as information you're giving to us. Because like in one situation, I have a person that just recently, she read several of those statements that coworkers made, and obviously now it makes it difficult for her going back into the workplace and not have some resentment at some of the things that were said. Ironically, she did something, and I would love to share with you, but I feel like if you ever heard of it, it's so unique or rare and kind of crazy that I would have breached her identity by sharing it with you. But from an employer standpoint, they didn't know what they were seeing in her, what she had done in the workplace. And they didn't know if they were seeing, we knew she was using impaired judgment, but not knowing what was driving the impaired judgment. But it created this huge disruption in the workplace, ripple effect. And so it was more being driven from grief issues. She had a series of losses that were really unbelievable, and I think that she might have some personality disorder, but remember, that's not really a personality disorder, isn't something, but they were able, and they'd been seeing some of that quirkiness before and couldn't figure out if it was being driven by substance abuse, because once again, her work performance, spot on. Excellent, high productivity. So seeing that, they always balance that out with thinking that they're seeing a personality issue going on with her, until she did this thing in her decision making, which then disrupted the whole workplace, and then they were able to make the mandatory referral. And the beauty of that is now the EAP, now when you think again from a litigation standpoint, the EAP is now responsible, and we say, yeah, she's fine going back into the workplace. This is more of a personality disorder that we're seeing. The issue becomes in a person's ability to make good decisions. So again, sometimes people, the bottom line is we're looking at make decisions that are safe for everyone that they work around, right? And that's why when we think about what substance abuse does, is it impedes their decision making, and they put people at risk from that. But lots of problems put people at risk, and so this company was very vigilant in watching her, looking at work performance, noting in their notes some of her quirkiness, and they have used that word, quirky, but when she read then some of the statements later, it would feel very, I question.
What about taking those statements as a manager, supervisor, chief, and writing a statement of your own, signing off as management saying based
finite,
yeah.
Compared to, we've watched the loop of it, right, where in the beginning we didn't realize people would cheat or could cheat, and then we started having then when we realized that, we started having people come into to watch it, whereas now they're able to test, so well. The only thing they struggle is if someone's bringing in
right, and it surprises me to see that article in the paper in this age because, like I said, up here I've never seen it, and
well, it makes you wonder now what will happen with that practice of having,
I think it'll go away.
I do too. But think about it. from a litigation standpoint, moving forward into this next decade, confidentiality, protecting that person's rights, their privacy, is going to be what the focus is going to be on. And and with that, wanting to make sure, that individuals, like maybe for the employees this year, you might want to have a copy of the policy or a sign off that they have read and reviewed the drug and alcohol, your drug-free workplace policy here. And so I think the last couple of years I have really encouraged everyone to start looking at the difference between when you recognize that someone's in crisis, right, which that we can see that, versus when you start to see performance problems occurring. And I think everyone feels probably more comfortable or adept at managing the crisis situations because we can recognize that more obviously when it's happening, and we feel more justified in acting on what we're seeing, whether it be that person has threatening behavior or the impairment is obvious, or we find that they're in possession of alcohol or drugs, or they're engaging in an illegal activity. It's interesting, I have a school right now though that has all of this and has still not, it's been 2 months, and they still have not made the mandatory referral. I know. Part of it is employers, I think, are fearful, again, both ways, trying to fear of being sued by the individual, but I think the greater fear would be something happens in the workplace, and, but it shows everyone, has that litigation piece over their heads about that. I have another situation where they recognized the person, when you think about the performance problem, she did not have any performance problem, but they witnessed the rapid weight loss going on. She had a back injury, was out for the 4 weeks, comes back to work. They know she's on her medications. She starts to begin this rapid weight loss period after that. They never documented impairment, and they drug tested her without the impairment piece, and right, huge. Yeah. So, and it's funny because we go in and we talk about that these are the steps. So, it's easy to, like I said, sometimes it's easy to recognize the crisis things, but when we start to look at the performance part, you want to show that those performance decline, that performance decline. So we realize, like we talk about with addiction, that we're looking at compulsive behavior to use and the person's efforts to try and quit, increased tolerance, increased disruption in the family, and especially as supervisors, I'm sure you hear either, I don't know if you make a practice not to go out after work with individuals that you supervise, because that can be a difficult gray area for you, but if you do go out with individuals after that you supervise and engage, go to bars or happy hour or, and you become aware, and you might be seeing that some of those signs of high tolerance in an individual, or using poor judgment in maybe how much they're choosing to drink, and you now start to have prior knowledge of that. You want to look at, again, like the ongoing performance problems don't respond. You don't start to see them improve from efforts that you're making in those corrective actions, so you want to make sure that you're always documenting that part. I think that the attendance issue, usually it is the number one reason when you start to see that the person's calling off or this piece happens, that's your cue to start looking at other things. And so that's kind of like my easiest way to say, I think that, and we see that as the most common piece, that attendance piece often becomes a red flag. Whether or not that attendance piece is substance abuse, they could be struggling at home with family. They could be having financial issues. Another thing with the new merger, So while Tri-County has always had financial counseling, we had a financial counselor. I can tell you that it was purely, a lot of it was from a marketing effort. I advertised it. 90% of individuals that made an appointment to see our financial counselor no-showed, never showed. Because I think that it's a humbling thing, again, some of that denial and minimization, that they feel that panic in making that financial appointment, but then they didn't want to come in person. With the new EAP, they can call the 800 number and talk to somebody online. They don't have to come in and have a physical appointment. And so I think that that is a huge positive also in all of this. But we do know, right, that there's a lot of denial with that financial piece. We know that that financial problems that individuals are struggling with creates a lot of these performance problems that we see. Sometimes the financial piece can then shift in and create a substance abuse problem for individuals. Sometimes it's the reverse, right? The substance abuse problem creates the financial problem for them. And then starting to see mistakes and missed deadlines from that person. So again, being able to detect it, performance monitoring is key to that. Because the abuse piece may not be obvious. We do know that abusers work really hard and are really good at times at hiding what's going on. And I cannot remember in the timeline of last year where I was at, if I had come here yet before I'd gotten from a company, about the gentleman that people were telling the HR that the guy was drinking all day long through work. Did I tell you about him? No. So they get this, they've had several different people tell them that. They had prior knowledge that he had been through treatment previously, like 7 or 8 years ago. They were getting all these tips. They absolutely had no documented performance problems from him. Stellar, right? They test him based on those tips, and he tested positive. He comes into me. He confesses he would drink in the parking lot before he came into work. He would leave on his lunch hour and drink. He would sit and pop a beer in the parking lot before he pulled out of it. I mean, he maintained, though, a blood alcohol, he normalized all day long. And kind of angry, but he also then, once we started talking, he was relieved. He had obviously had to go into treatment at Glen Bay. But it's one of those cases where the employer went ahead, and because of the nature, he had some safety sensitive work that he did there. They were trying to go up and smell it on him, and they could, they were being able to.
Some of that can be residual, though.
Yes, and so right. It doesn't mean necessarily they're going to test.
That is correct.
But with him, they had taken that prior piece of information. They had made some of those efforts to smell it on him, yep. But it's difficult because you have to document why you're doing this. Now, employees don't always know that, though, unless somebody else has come in and cued them. A lot of times your employees don't know that there has to be some, that unless, of course, you've been really thorough in going over the whole drug-free workplace trainings to them and why there's testing. We also know that coworkers sometimes, so in this case, coworkers were talking and going, because it does impact them. It is disruptive in the workplace when that's happening. But in this case, they didn't have any problem going up and telling them. And then we also know that family and friends may be involved as well. So alcohol abuse, though, when we make that distinction, we're just looking more at social drinking, symptomatic drinking. But we also know that all of that can lead to addictive drinking. So, even if that person coming in is impaired no matter what, and you have to act on recognizing impairment, whether or not you think that impairment is a function of addiction going on, or whether it was poor judgment, because you have to make sure from a litigation standpoint that you have taken steps to ensure the safety of that person also, that person and everyone else. And for those of you that have used the EAP or made a mandatory referral to me, you know that it is not punitive. we strive to make it be corrective, to help support that person regardless of what the reason is that they're being referred for, to maintain their job. That is our goal in that. I can tell you that one of the problems in, like, say for that gentleman, he went to Glen Bay, so obviously he's out of work for a long time with Glen Bay. Glen Bay wants him to do an intensive outpatient thing. He wants to get back to work. And so, you know, he wanted to use his EAP benefit for coming, and so there becomes then sometimes that difficulty to the employer, because wanting to try and support them in being able to make their, maintain their job and their income using the EAP. I would say from an employer, and the employer is always urgent, wanting that person to come back because they need them. The best protocol is to follow the inpatient, the IOP, and then using the EAP at the very end, because inpatient, it's easy for people who don't want to drink to not drink. Coming back out, it is very difficult in making those changes, especially for like someone like him who has so many triggers. Drank before he left the house, drank in the parking lot before he went in, drank at lunchtime. It was too. That is the value of. And for those of you who don't know, IOP stands for Intensive Outpatient Counseling and Program. And employers sometimes think, and that individual himself thought it's just a moneymaker, but it really is, for that type of alcohol addiction and use, it really is something that is invaluable in helping someone sustain long term. So, again, some of the excessive use of sick days, the tardiness, sudden decisions to use vacation time, looking at involvement in accidents, near misses, starting to look at their errors. So again, remembering that the first cue is how their attendance looks like, and then that's meant to make you look closer at things. I don't know, we have down heavy use of breath sweeteners, I don't know if that necessarily is, but you can use that as a greater picture of what's being seen. Fatigue, weight loss, facial changes, and so it's interesting if you see there's diet pills that are by prescription only by a doctor out in Cuyahoga Falls, but if you look at some of the women that are losing weight from that, it resembles like meth, like people that, it's that abuse meth, that these women have some of that look, and you figure that in that chemistry, these diet pills are a stimulant. You see crazy rapid weight loss. It doesn't matter that a doctor is prescribing them. It's like a new thing that we've been looking at, and for some individuals, they're speeding on that, and it can create work performance issues. And the whole thing is that you're just meant to look at is that, are you seeing impairment? For here, I like this because I think for you as supervisors, this allows you, again, some objective things when you can say, when we talk about what does impaired functioning look like, or oftentimes we see these as personality issues, but remembering we want to look at how does this impact functioning in the workplace with coworkers or other individuals. Low tolerance for frustration. Are you seeing impulsive behavior? Know-it-all attitude. We know that some of that is just a personality trait. Oversensitivity, isolation, the defiance or defensiveness, rationalization. And with the drug abuse, sometimes we don't necessarily see all of those same behavioral things. We might be seeing other issues, and especially the change in appearance. And so maybe they're more disheveled. You notice that maybe they're not changing their clothes enough. They're not having as good of hygiene as you might have previously associated with that person. Again, some of the same things that we would see with the alcohol abuse, mood swings, false confidence, secrecy. Do you do a 10 panel?
Yes.
I still do that. So again, but we know in the workplace, oftentimes, especially for professionals, that these are the more common ones that we see being abused. Like I said, I'm not going through all the categories like I do for you guys normally in prior years. Again, still prescription drugs are what we see the most common, especially of abuse, especially for individuals that have physically demanding jobs or that create a lot more aches and pains for them, that you tend to see that might be, I know for a lot of the companies that have large maintenance departments, we see a lot more substance abuse there because they start off being prescribed the pain meds and then it lapses over into abuse. Right now, though, hospitals, right, like I always share with you, my husband works in a hospital, radical change in pain prescribing. So in the old days, you gave them as much as they wanted so they wouldn't be in pain. Now, he said it's crazy that
They went too far the other direction.
they've gone,
for
it's
people that are
his
legitimately there
perception.
for it.
That's how it should be done.
Okay.
So that's why I'm saying, especially in this new piece of it, yes. Because again, wanting to protect those other individuals,
Absolutely.
their confidentiality as well. And so also wanting to make sure that, sometimes individuals feel, very defensive when that mandatory referral is being made, and their biggest piece is wanting to know who's going to know. Obviously, when that mandatory referral happens, they're out of work then for a while. So, again, do you have a way, how do you explain their absence in the workplace? You have to explain their absence. Thank you. No, you do not have to explain their absence. Exactly.
People don't need to know anything other than that.
That is pivotal, not to explain their absence to others, because that is part of that protecting their confidentiality. When they come back to work, if they come back, they can decide what they want to share with other people, why they were gone. But you do not explain why that individual is absent from work. And that's the piece, too, that you want to reassure them, is that their issues will not be made public. As well as any of the conversations with the EAP professional, that information, again, is very protected. And that piece has not changed in this process. The sign-off, the releases look different. I don't know if you compared, like, our releases, we were very specific in our releases that they knew we were only sharing whether they were cooperative or not, the dates that they were seeing, and that we were sharing with the employer treatment objective. So our releases kind of, I felt, were more reassuring to individuals incoming, but I would encourage you to share that with them as well, because I do not share personal information in my conversations. The information that gets released is all just related to performance. And that's a legal issue that everyone has to maintain as well. Information, though, like about referral to treatment. So again, like for this gentleman that I was talking to you about that went to Glen Bay, as an employer, you want to think about where does that information go, because that's difficult. Obviously, for him in that workplace, everybody was making their, of course, the rumor mill went out because all of a sudden now he's gone for 3 months. And that's the problem is, I want to say, from a hardship standpoint, we can all relate what that would how that would impact somebody being out of work for 3 months. It cost him $18,000 for treatment there. So when you want to think about, we have treatment facilities that are more affordable, like at IVH and that, but again, maybe as a professional, that's not the best fit for him going through his recovery like it would be for him to go to Glen Bay. But now he's out of work 3 months, huge debt, and the employer was supportive of him not doing the IOP. And so the long story short, 6 months later, they're smelling alcohol on his breath again, so. Because we know, right, that we still, even as a society of years of treatment, and we don't have good effective means for individuals yet, and what does that look like? So remember, the employee can choose to tell coworkers about their private concerns. That becomes their decision. But you, as a supervisor, do not share any of that with individuals, even individuals that have shared with you information. That does not entitle them to information then about why that person's absent or what's happened. And the hardest part is, especially if you've referred somebody for anger management or something like that, employees want, maybe that were the recipient of that anger and that, they want to know what steps you have taken, but they don't really get to know that. And that becomes then a difficult piece as well. Your pat line would always just be, we have taken steps to ensure the safety of the work environment, so you can have like a pat line like that you're going to utilize, but you can't reassure them that, yes, we've put this person in anger management, and what we find is that person at times will tell people. I had a supervisor that came, and he has chosen, he was a recovering alcoholic, 12 years, but he still had some of what we call the dry drunk personality, so he had lots of problems supervising. He supervised in an angry way, and finally they sent him for a mandatory referral, and he chose, as part of it, to share in his efforts moving forward that he was in recovery, managing his anger. That he had added that he was reworking some of his steps. So he chose to be really healthy in how he was going forward, but part of it he knew he was kind of in his last chance efforts because his stuff was pretty extreme. When we talk about demeaning and stuff, the documentation and him seeing all of that documentation visibly, had a greater impact on him when he saw those timelines of things that had been reported. So it is effective when done correctly. Okay. So we're going to keep going so we can get the big piece too, especially if someone has tested positive. So I'm going to just go off the grid on a lot of this. Is remembering if they've tested positive, they come into the EAP, we deem it based on the limited information we have from them and that it was poor judgment, right? Send them back in. Don't go, oh, I don't have to look anymore. I mean, I would tell you that's when you start looking more, right? And making sure now you're going to keep looking for the performance issues. Because this is an imperfect process, when a person tests positive and you send them to us, and then it's an opportunity to allow them really to impact individuals who abuse substances or misuse them. Did you stayed up and watched the Browns win last night? I'm always and you might have been drinking while you're doing that, and then you have to come in this morning for this early meeting, and they smell alcohol in your breath, and they have to test you, right? So it might be, you might think in your head, this is ridiculous, but if that person continues to use poor judgment that way, it might begin a pattern of behavior. Remember, I think I shared with you last year that when the Cavs won, I don't know how long ago it was, I had all those teachers, remember, coming into work and testing positive and being sent for mandatory referrals because they could smell alcohol in their breath. I can tell you it was 5 or 6, it was a lot. One of them had addiction. So the other ones, they were horrified. It could be a life-saving measure. They never realized that they were coming in impaired. They didn't realize they could have gotten a DUI. We talked about things like that. But for that one person, I can tell you, so it might have been 2.5, 3 years, because she's been sober now for that long. So I always encourage that becomes the thing that you want to make sure that, that you don't just disregard it and that it's just a routine or a hoop that everyone's had to jump through. That's really the time to look at, especially if you need to adjust things for that individual and helping them do things differently. But always that respect for their privacy, making yourself available for conversations with them so that they don't feel also that they have to come to you that it looks poorly on them. And a lot of times people don't want to go back and share about what they're struggling with because they're afraid that it's going to be used against them. And really, that then sets in motion then a whole other set of problems and stuff. So remembering, we always have to bring up that enabling is efforts that you take that either minimizes the situation or protects the employee from the consequences of it. So you might, whether you work harder or make up for their problems or you're rationalizing it. Avoidance, I think that I find over the years most people just avoid when they start seeing something like that because they're hoping that will just eventually go away. So do emphasize with individuals though that I think that you're only really concerned about work performance or conduct. So sometimes when they feel, like I tell you, they come in, they feel it's a personality issue, but you want to make sure that you're in your conversation, that you're emphasizing, I'm concerned because of these behaviors that I'm seeing, because of these performance issues. And again, the documentation piece is pivotal. The beauty of all of this is that you get to utilize the EAP and tell them that this is a supportive. And I really encourage you, in you thinking about what some of those words look like, that they have a confidential place or resource available to them. And remembering, sometimes you benefit, if you start to see the behaviors early, you can suggest, I brought the new brochures, we have the little wallet cards available, what we would call soft referral. I don't know from here, but from other companies, I've had individuals feel validated from their supervisor when the supervisor just made like a soft referral saying, well, I can tell you're going through some things, they confide things to you that you would recommend or encourage them to utilize for that. Documented too somewhere that you had that conversation, but I can tell you I've had numerous individuals say they've come because their supervisor thought it was a good idea and they felt recognized or heard in the workplace. And, we recognize, right, in this world that that's like the number one thing. People don't feel like they're heard anymore. Sometimes that's all that counseling is that they sit and tell me their story and that they have someone listening to them. Not to undermine or diminish what I do, but I can tell you that for some individuals, that is what I'm doing, is letting them, is hearing what they're saying or hearing their story. So some individuals really feel supported and valued when by supervisors that have encouraged them to come. Any questions? I know you guys don't need all this. Any questions or comments? Again, here's about, because now we're called Life Services. Again, I think that encouraging the recognize you have a much broader provider network. You guys have that access. You can access us. I can always help you with any kind of consultation. We have Margie Group, who's also, like I said, she's the regional manager and would support that. Everybody's ready to go? Yep. Go!